Imagine being a Filipino nurse who has spent years working night shifts in a busy American hospital. You have comforted strangers, stabilized critical patients, and stood on the front lines during national emergencies. Then one morning, you open the news and discover that your state has passed new laws that could make it harder for you to keep your job, not because of your performance, but because of where you were born. For thousands of Filipino healthcare workers across the United States, this fear is becoming real. These professionals are not temporary helpers. They are nurses, therapists, caregivers, and technicians who form the backbone of many hospitals. Many work in understaffed facilities where replacements are already hard to find. Okay, and what makes this situation even more alarming is where these changes are coming. Families in the Philippines depend heavily on money sent home by overseas workers. Remittances from Filipinos abroad exceed $30 billion each year. That money pays for school fees, medical bills, housing, and daily necessities. When a healthcare worker in America faces job uncertainty, entire households feel the shock. This video explains why several U.S. states are tightening rules that affect foreign healthcare professionals in 2026. We will examine policy trends, real-world impacts, and long-term consequences. Then we will count down 10 states where Filipino healthcare workers face the toughest conditions, starting with number 10 and moving to number 10, Idaho. Idaho may not appear in national immigration headlines often, but for Filipino healthcare workers, quiet policy shifts are creating serious uncertainty. The state requires close cooperation between local law enforcement and federal immigration authorities and prohibits sanctuary-style protections. While these rules target enforcement, hospitals feel the consequences. Immigrants represent a small share of Idaho's population, yet more than 10% of registered nurses are foreign-born. That gap tells an important story. Idaho's healthcare system depends heavily on internationally trained professionals, including many from the Philippines. In 2026, licensing boards have expanded verification steps for foreign education, clinical hours, and employment history. Background checks take longer, and even minor documentation inconsistencies can delay approvals. Hospitals report that onboarding international nurses now takes weeks longer than before. For Filipino professionals, this means delayed start dates, postponed renewals, and hesitation from employers about sponsorship. Rural hospitals are hit hardest. Some facilities have reduced elective services, while others struggle to staff night shifts. Supporters of the policy argue it protects local workers. Critics point out that Idaho simply does not produce enough nurses to replace those leaving. As a result, Filipino healthcare workers increasingly view Idaho as a state with growing career risk rather than long-term stability. Number 9, Arkansas. Arkansas enforces strict limits on local government assistance to undocumented residents and bans immigrant protection policies. Although these laws are not written specifically for healthcare, they shape how hospitals approach hiring. The state already faces persistent nursing shortages. Many hospitals report double-digit vacancy rates, especially in long-term care and rural facilities. Historically, foreign-trained nurses helped fill these gaps. In 2026, Arkansas hospitals are becoming more cautious about international recruitment. Legal compliance costs are rising, and some employers avoid visa sponsorship altogether. Licensing boards now request additional proof of overseas education and clinical experience. Filipino nurses report longer license processing times and fewer job mobility options. Changing employers often triggers a fresh verification cycle, which can delay income and disrupt families. Immigrants contribute billions of dollars annually to Arkansas's economy through taxes, housing, and consumer spending. At the same time, healthcare leaders warn that staffing shortages increase patient wait times, nurse burnout, and medical errors. For Filipino professionals comparing states, Arkansas now feels less predictable. While opportunities still exist, the pathway has become more complicated and uncertain. Number 8, Arizona. Arizona is known for some of the strongest state-level immigration enforcement in the country. Police may verify immigration status during certain encounters, and workplaces are subject to frequent compliance audits. About 13% of Arizona's healthcare workforce is immigrant. In many hospitals, foreign-born nurses are essential to daily operations. However, nursing board data shows higher delay rates for license renewals involving foreign-trained applicants. Even workers with valid visas face extended processing times. Hospitals say these delays disrupt staffing schedules and force departments to operate short-handed. Some units rely heavily on overtime, increasing burnout. For Filipino healthcare workers, uncertainty affects life decisions. Buying a home, enrolling children in school, or pursuing advanced certifications becomes risky when employment timelines feel unstable. Arizona's population is aging rapidly, increasing demand for chronic care, dialysis, and elder services. Yet international nurse recruitment is slowing. Supporters say strict enforcement ensures compliance. Critics argue Arizona is discouraging the very professionals it urgently needs. Number 7. South Carolina. South Carolina requires immigration status verification in many interactions with public agencies and allows strong cooperation with federal authorities. Approximately 6% of healthcare workers in the state are foreign-born, but that small percentage plays a crucial role in keeping hospitals functional. Hospitals report growing shortages in maternity wards, rehabilitation centers, and rural clinics. Foreign-trained professionals often face additional credential reviews and document verification. Filipino healthcare workers report longer licensing timelines and fewer hospitals willing to sponsor visas. Many choose to relocate to states with faster processing and clearer rules. High turnover increases recruitment costs for hospitals and reduces continuity of care for patients. For Filipino professionals, South Carolina increasingly feels like a stepping-stone state rather than a permanent home. Number 6. Tennessee. Tennessee has expanded workplace enforcement and employer penalties for documentation errors. While intended to increase compliance, hospitals say the policies have changed hiring behavior. Foreign-born workers make up roughly 6% of Tennessee's healthcare workforce. In critical departments, that percentage is much higher. Hospitals report fewer international applicants and reduced visa sponsorship. Employers fear penalties if paperwork mistakes occur. Filipino healthcare workers report additional verification steps during license renewals and job transfers. Rural hospitals struggle most. Some rely on temporary staffing agencies, which are more expensive. Healthcare leaders warn shortages may affect emergency response times and patient outcomes. Tennessee still needs healthcare workers, but policies make recruitment harder. Number 5. Alabama. Alabama allows broad immigration status inquiries and bans sanctuary-style protections. Healthcare employers must follow strict verification procedures, and penalties for non-compliance are severe. Hospitals report longer onboarding timelines for foreign workers and growing recruitment difficulties. Filipino nurses report extensive document reviews and fewer sponsorship offers. Some hospitals have quietly reduced international hiring despite shortages. For Filipino professionals, Alabama presents growing uncertainty. Number 4. West Virginia. West Virginia allows local cooperation with federal immigration enforcement. Immigrants make up less than 2% of the population but are critical in healthcare. Projections show a possible 20% nursing shortage by 2030. Hospitals struggle to attract both local and international staff. Filipino healthcare workers face limited sponsorship opportunities. Without international recruitment, rural hospitals risk service reductions. Number 3. Texas. Texas mandates cooperation with federal detainer requests and conducts frequent audits. Texas has one of the largest immigrant healthcare workforces in the country. Filipino nurses play major roles in hospitals and nursing homes. State data shows declining international nurse applications. Hospitals face heavier workloads and recruitment costs. Despite massive demand, sponsorship opportunities are shrinking. Number 2. Iowa. Iowa bans sanctuary jurisdictions and requires employer verification. A recent workforce report showed a 9% decline in foreign healthcare hires. Hospitals report slower hiring and higher legal costs. Filipino workers face limited job mobility. Recruitment pipelines are weakening. Number 1. Florida. Florida has some of the strongest employer penalties and expanded verification rules. Immigrants make up around 20% of Florida's healthcare workforce. Reports show sharp declines in employer-sponsored healthcare visas. Licensing delays and audits are increasingly common. Filipino professionals report growing uncertainty. Florida ranks number 1 due to scale of enforcement and massive healthcare demand. Filipino healthcare workers have served America for generations. They have staffed hospitals, cared for the elderly, and supported communities. The question is simple: can the United States afford to lose this workforce? These policies aim to regulate employment, but they may also reduce access to care. The Philippines continues to train tens of thousands of nurses each year. Many are ready to serve globally. The future of healthcare depends on balanced policy. If you are a healthcare worker or family member, share your experience. Which state surprised you the most? Your voice matters.